Good morning. I'm Jim Childress, Professor Emeritus at the University of Virginia. As chair of the planning committee for this workshop, I'm pleased to welcome all of you, both here in the lecture room and on live webcast, to this workshop. This workshop is being hosted by the Board on Health Sciences Policy of the National Academies of Sciences, Engineering, and Medicine. The Greenwald Foundation is the sponsor of the workshop. Through workshops like this and other activities, the National Academies bring together thought leaders to focus substantial public attention on critical areas of health science policy. In accordance with National Academies procedures, an independent planning committee organized this workshop. Your handouts include a list of the planning committee members with their bio sketches, and I want to take this opportunity to thank the members of the committee for their excellent work on this, as well as thank the National Academy's staff for their tremendous work as well. As a standalone workshop, this is not part of an ongoing study by the academies. The final product will consist of a summary of the presentations and discussions during the workshop. It will be prepared by a rapporteur and will reflect what transpired at the workshop. It will be prepared in accordance with institutional policy and procedures, will be published by the National Academies Press, and will be made broadly available to the public. All views presented in the report will be those of individual workshop members or participants. The report will not contain findings or recommendations by the planning committee. A few words about the scope and intent of this workshop. The full statement of task is available on the cover page of the agenda. We're here to discuss what is known empirically and not known about the practice of physician-assisted death. We're not here to debate the ethical pros and cons of the practice. We hope that the discussions today and tomorrow will suggest areas where more data and further research would be helpful and highlight opportunities to fill those gaps. We recognize that our workshop speakers and audience members come from a variety of disciplines and experiences and hold a wide range of views about physician-assisted death, from supportive to skeptical, to opposed, with lots of gray areas and nuances in between. Even though there are understandably divergent viewpoints, we have a shared focus here on seeking to understand the practice of physician-assisted death in the U.S. As you're aware, there are broad and narrow interpretations of physician-assisted death in contemporary discourse. The narrow interpretation is embodied in laws that have legalized physician-assisted death in several states in the U.S. In this context, physician-assisted death, or physician-aided death, or physician-assisted suicide, as it's also known, refers to the physician providing a patient-requested medication or prescription that the patient can use to end his or her life. This is distinct from physician-administered death, sometimes called active euthanasia, which is not legal anywhere in the U.S. This workshop thus focuses on physician-assisted death, not physician-administered death. But the latter will receive some attention in the discussions in session 4, where we hear from colleagues from Canada and the Netherlands about policies and practices of data collection in those contexts. There are a few announcements and housekeeping matters I should mention. This is a very full, even crowded, and intense workshop, as you've discovered looking at the agenda. But we will take a break now and then. We'll have a morning and afternoon break today and a morning break tomorrow. There will also be a lunch break both days. Boxed lunches will be available outside the meeting room, and there is a cafeteria on the lower level of the building for coffee. That cafeteria closes at 2 o'clock. Tomorrow we will be in a different meeting room room 125, which is just down the hallway from where we are today, and staff will be available to direct us. This workshop is being webcast live, and about 150 have registered to join remotely. There will be considerable interaction in the sessions among the various presenters, and we want to involve you in that interaction as well. So audience members who want to ask questions and thus participate in the discussion at the times designated on the agenda should form a line behind these standalone mics. There are two of them, I believe. And the session moderator will call on you and call on as many as possible. When called on, please speak into the standing mics, and also please identify yourself. A request to the panelists in roundtable discussions: please turn off your microphones when you're not speaking in order to avoid the kind of noise that interferes with what we hear. The slides presented at today's workshop will be posted on the National Academy's website within approximately 1 week of the workshop. Finally, you will notice on the registration table handouts that speakers requested be distributed to workshop participants. I probably don't need to remind you that these documents are not products of or endorsed by the National Academies, but are provided to further inform workshop discussions, again, as requested by speakers. So now I'm pleased to welcome Linda Ganzini, a Planning Committee member from Oregon Health and Sciences University, to lead us through session 1. What do we know? The evidence and terms of discussion. Linda.